Hello guys, welcome to the Do I Suffer sessions. In our last video, we discussed acute pancreatitis. In this video, we will discuss chronic pancreatitis. This session will guide you through the causes, the pathophysiology, the symptomatology, the diagnosis and the treatment, along with some of the complications of chronic pancreatitis. Make sure you have seen our last video on acute pancreatitis before watching this one so you will understand the differences and the linkage between them. Hopefully you will like this video and subscribe for more. What is the definition of chronic pancreatitis? Chronic pancreatitis is a progressive inflammation of the pancreas resulting in irreversible parenchymal destruction leading to pancreatic insufficiency. What is the etiology of chronic pancreatitis? The etiology of chronic pancreatitis is heavy chronic alcohol consumption. Other causes include smoking and gallstones causing the biliary pancreatitis, idiopathic pancreatitis, hereditary pancreatitis caused by a gene mutation of the PRSS1 gene. There are two types of autoimmune pancreatitis. The first is increase in the subclass of IgG4 antibodies, and the other one is idiopathic. Systemic disease can also be a cause: cystic fibrosis, primary hyperparathyroidism leading to hypercalcemia, and severe hypertriglyceridemia. How is it caused? We have ductal outflow obstruction, which is going to stimulate the auto digestion and inflammation of the pancreas. Lastly, fibrosis will be caused due to the activation of the pancreatic stellate cells. In this picture, we can see the cause of the ductal outflow obstruction, which is pancreatic cancer. How chronic pancreatitis will be presented? Epigastric pain, which will radiate to the back, get worse on eating and relieved when leaning forward. The features of pancreatic insufficiency are gonna be endocrine and exocrine. Starting with the exocrine, gonna be steatorrhea due to the lack of absorption of lipophilic vitamins D, E, A, and K. Gonna cause malabsorption, weight loss, nausea, vomiting, bloating, and cramping pain in the abdomen. The endocrine pancreatic insufficiency is gonna be presented with pancreatic diabetes. In later stages of the disease, it's gonna be painless. So how do we diagnose chronic pancreatitis? Starting with the most important one, which is patient's history and clinical examination. Hopefully guys you found that out. Moving on to the imaging diagnostics, which is abdominal CT scan with or without IV contrast medium, MRCP, endoscopic or abdominal ultrasound, which can show strictures, dilation, stones, or calcifications, and abdominal X-ray, which can show calcifications. Moving on to the laboratory markers. In comparison to the acute pancreatitis, in chronic pancreatitis, we're gonna have normal levels of serum lipase and amylase. Hypercalcemia, if the cause of the chronic pancreatitis is primary hyperparathyroidism, and increase in the liver enzymes and liver function tests in case of biliary pancreatitis. Other tests that are important in diagnosing chronic pancreatitis include genetic testing for the PRSS1 gene mutation and the pancreatic function tests that measure the fecal elastase 1, which will be decreased if the steatorrhea is due to exocrine pancreatic insufficiency. Other tests include cholecystokinin analog and secretin test. Now guys, that we know the cause, the mechanism, the symptoms, and we diagnose chronic pancreatitis, how do we treat it? Due to epigastric pain, especially in the early course of the disease, we have to give patient analgesia, starting on non-opioid analgesics like non-steroidal anti-inflammatory drugs and acetaminophen. Other more interventional approach to analgesia is the celiac ganglion block. The patient should have abstinence from nicotine and alcohol, should take small regular meals with increased carbohydrates and decreased fats due to the exocrine pancreatic insufficiency, replace the pancreatic enzymes along with the meals, give parenteral lipophilic vitamins due to exocrine pancreatic insufficiency, so the vitamins D, E, A, and K will not be absorbed. Treat the endocrine pancreatic insufficiency, which will cause pancreatic diabetes treated with insulin. And finally, surgery. What are the complications of chronic pancreatitis? So, as we discussed earlier, endocrine and exocrine pancreatic insufficiency is one of the major complications which is responsible for most of the symptoms. Other complications include pseudocysts, which are encapsulated collection of the pancreatic fluid, acid test, which is the free fluid in the abdominal cavity, abscess formation, portal vein thrombosis, splenic vein thrombosis. As you can see here, the splenic vein runs behind the tail of the pancreas. This is gonna cause inflammation of the splenic vein, leading to thrombus formation and left-sided portal hypertension. Left-side portal hypertension is gonna present with gastric varices, but without esophageal varices. Thank you guys for making it to the end of this video. Hopefully you enjoyed it. Please hit that like and subscribe button. See you in our next video.